Good afternoon, everyone. Thanks for joining us on time. We're going to go ahead and get started. Hope you're at your desk, grab some lunch. I'd like to thank you for joining us for our second session in our HITRUST webinar series. Today, we're going to cover how to scope your environment and how to define the risk factors related to your scope. Let's just go over a couple things before we start. All attendees will be muted throughout the session, but we do encourage you to ask questions using the Q&A feature. Jesse and I will be watching those questions throughout the hour. We'll save some time at the end if we don't answer them during the presentation. And also, this session is being recorded, and all attendees will be receiving a link to the recording as well as a copy of the slides following this presentation. So look in your inbox for that tomorrow. And just a little bit about us before we get started. Kirkpatrick Price is a PCI QSA, a licensed CPA firm, and now a HITRUST assessor, providing assurance services to clients worldwide. Our firm has over 12 years of experience in information assurance by performing assessments, audits, and tests that strengthen security and compliance controls. We offer both regulatory compliance and information security services. We provide consulting services such as policy and procedure drafting, risk assessment, internal audit plan and development, and readiness audits. We also provide guidance and audit services on frameworks such as HIPAA, SOC 1 and SOC 2, PCI, FISMA, HITRUST, and ISO 27001 and 27002. We encourage you to connect with us by subscribing to our blog, following us on social media, and checking out our library of recorded webinars so you can catch up at any time. And now I'd like to welcome our speaker for today, Jesse Skibby.
Thank you so much, Jenna. I'm super excited to be here for our second webinar in this series, and I want to just quickly introduce myself. I can't believe that number 20 is up there, but I have over 20 years of information technology, security, and regulatory compliance experience spanning through multiple industries, starting off in manufacturing, entering into financial services, and also the healthcare industry. I'm a former developer, network administrator, ISO, and CCO. So as you can tell, I've worn multiple hats throughout my career, which I think gives me a unique perspective on this topic, as well as, what our clients really need when they're trying to meet multiple audit objectives and stay compliant and keep information secure. So I'm very focused on helping our clients meet their security and compliance objectives. Part of my role here at Kirkpatrick Price is I help develop new services based on what our clients are really needing, and really help from all aspects of, cradle to grave delivering of those assessments, as well as quality. So I have a quality hat on as well. As you can see, I do have a few certifications. I'm not going to read those off to bore you, but just wanting you to know, I think first and foremost, the one I'm one of the most proud of is the CISSP. Of course, I've had that since 2005. So definitely have had a lengthy career in information security, as you can see as well. I'm very involved with the ACA Association for Collections Association, as well as other receivables management industry. So much of my background is in the receivables management and financial services industry, and also a CSF practitioner. So we can move along. Of course, this webinar today is not intended to be legal advice. So I will read this disclaimer just briefly to you so you understand that no attorney-client relationship is being established by viewing this information, and should you need that advice, please consult with your own attorney. Plus, I am not an attorney, so this is not in any way legal advice. Okay, so last time I wanted to quickly recap what we talked about in the last session, because that session is available in recorded format on our kirkpatrickprice.com website. So if you missed that and you're just now joining us here for the second one, the first one we really just I wanted to go through and describe to you, who is HITRUST, because the concept of this series really kind of starts with, did you receive a letter saying you must be HITRUST certified? Have you been hearing it in the industries that you're working in? Are you in the healthcare industry providing services, and you're understanding that you must be HITRUST certified, for example, to either gain relationships with some covered entity clients or just to retain that relationship and that competitive nature? So if it's your first experience of, hearing the words HITRUST, wanting to know who they are, how is that different from the HITECH Act, for example, which some people can get very confused. HITRUST, as I mentioned during the first session, is an independent organization, a not-for-profit organization that develop and maintain the CSF, which is the Common Security Framework that we're talking about. So it really just gives you, I wanted to give you in that first webinar a 5-step process to really get you on the road to meeting compliance. So the 5 steps you'll see there are really what the first webinar discussed. So if you didn't catch that, definitely go back and review that if you're interested in seeing that kind of groundwork, that background. So today, we're going to take the next step. So assuming you already know who HITRUST is, you understand that there's a common security framework that's being adopted, now we're going to get into more of the grassroots, definition of how do you scope your environment, because scoping your environment is the first step that you really need to take before you start anything else, before you start a self-assessment with the MyCSF tool, before you start a gap analysis with your assessor, in fact, before you even engage with an assessment firm. Scope is such a critical part because understanding what systems and what your scope is really the first step. So we're going to talk about how to scope the environment, and then we're also going to talk about how these defined risk factors will relate to your scope and how that begins to build the assessment. Before I go to that, I wanted to give you a couple of links because a lot of this information and really derives from a lot of the information that HITRUST themselves have developed. So, I want you to look at us as your guide. We're going to try to take all this information, process it in such a way that it makes sense to you, but I also want to empower you with another set of information. I'm not sure, I can't quite copy and paste this link in here, so I may have to send it to you, Jenna, to get it out to the group. But I wanted to provide you with a couple of links to the HITRUST Alliance website because there is some really great assurance documentation that you can download and read through yourself and kind of get an even deeper look. So today I want to give you high level of scope. I want to make you aware of the factors that you're required to understand, but I also want to give you more information so that you can dig even deeper after this webinar. So anyway, let's go on to the next slide. I'll figure out how to get those links out to you here in just a minute. So I want to start, obviously, with what we were talking about here in scoping the environment. The first and foremost thing that you really have to understand is that you're looking for those systems, those business units, those geographical locations where the EPHI, the protected health information, is stored, processed, and transmitted. So when you're looking at your entire company, now sometimes in smaller companies this may be the entire company, but if you're a larger organization, maybe you have international locations or maybe you have multiple business units that are working for different segments of types of clients. Maybe one segment of your business is working in healthcare, the other may be working in financial services, and et cetera. So you can define the scope within use of the CSF, and by performing the assessment, you can really narrow down on scope. But there's some criteria that you have to understand that it has to be in place before you can limit that scope. So, for example, a business unit here is defined as a unit or department within the organization that can operate distinctly from one another. And then, of course, the system is defined as an information system that will be the primary focus of the CSF assessment, supporting systems and applications that store and process covered information, as well as are all within the scope of an assessment. So what would really be helpful here, if you don't have this already, if you want to create a data flow diagram. I know many companies have these because a lot of the companies we audit are required to have them, because it really does provide a trail of, where does the data come into your environment and where does it go out. So thinking of all those touch points within, the systems that actually touch the data coming in and going out. So defining the scope, like I said, is the step one, because if you're not understanding where the data is being stored, processed, or transmitted, you really don't know, who to bring into the discussion during the assessment, who to involve, how to apply controls to those particular systems, and really how to proceed through the assessment. So, and this is really what starts to build the assessment. So, for example, if you know exactly which systems are in scope and which systems are not in scope, the numbers that we're going to talk about in the next few corresponding slides will apply to those systems. So, for example, if you know the amount of data that's being stored or transmitted on those systems, those are some of the risk factors that are going to determine how the assessment is built. So, for example, we talked about in the last session that up to 845 requirement statements can apply to your scoped environment. So if, for example, you don't have, depending on the number of records you have, for example, that's applied to this particular scope, your questions may be, 345, they may be 600. So I'm going to kind of talk you through how the scope of your environment really affects that. So you're going to be also asked to describe the individual systems or groups of like systems when you first begin your either self-assessment with the MyCSF tool or your validated assessment. So really put some thought into the scope of your environment, meaning do you operate on a flat network, meaning is there no segmentation in your network? Sometimes in smaller organizations that's the case. So in that particular case, everything would be in scope because there's no network segmentation. So again, think about the systems that store, process, or transmit, and also the supporting systems and applications that also support that system and data also transmits through. All right, so we can go on to the next. Let's get into this in a little bit better detail. So this gives an example. This webinar series is really focused on the Business Associate's Guide to HITRUST Compliance. So I'm really kind of focusing on that. It's really not any different when you're talking about a larger covered entity or hospital system, for example. But in this particular case, I'm really focusing on the types of applications and systems that mostly apply to a business associate. So kind of keep that in mind as I go through this. But this really talks about all the systems that you need to think about when you're defining and scoping your environment. So again, I'm going to say it one more time, storing, processing, and transmitting of PHI. So the data flow diagram that I was mentioning earlier really does give a great graphical representation of this, because many times during the audit process, this is what happens. We actually will go on site and we will search for data within the systems. And sometimes people don't realize, maybe the system administrator or the information security officer doesn't necessarily know that people are downloading and storing data on particular systems. So knowing every system that should have data and that you're actually protecting is all kind of part of this within your scope. So I want to give an example here too. So on the slide here, we see that things such as patient care systems and databases, applications and devices that store or process, obviously are things that you would need to describe in your scoped environment. Keep in mind that like systems can be grouped together when you're describing these in the MyCSF tool. So if you have, databases that are the same, one is a replica of the other, those can be defined together. Also thinking about those supporting systems, as in the second bullet point here, thinking about billing applications, customer service, general administration applications that may be involved in the process and also could contain PHI. And of course, don't forget, the infrastructure components, such as the router and the firewall that are actually involved in the transmission of data. So like I said before, something like a data flow diagram would represent the entry point of where the data comes into the system and then the exit point of where the data is leaving the system. Because something like that would give you all of the systems that would be in scope so that you could list them out within your assessment, and you can know during the assessment who are the appropriate people to bring in to the project. So for example, if the billing systems are in scope and they're containing a certain level of PHI, you're going to need to know who is responsible for that device, for that equipment, and who can you bring in during the interview process, because these are things that the assessor is going to want to know during the assessment process, because there's several components of interview and observation that have to be performed around those particular systems that are in scope. So as I mentioned, a data flow diagram can be very, very helpful. So I want to give an example too. Many of our clients are in, for example, they're doing printing and mailing services for a covered entity. So in this situation, think about all of the systems that are required for printing of those letters, mailing of that information, and processing and storing. Now, don't forget that when information has to be sent out to a third party, considering what third parties are also receiving that information, how they can be brought in to your scope. So also another situation we have quite often are maybe collection agencies that are collecting on medical debt. In that situation, depending on the size of the organization and how they're structured, everything may be in scope. If they're a collection agency of maybe 100 people or less, a lot of times, there's similar systems. There's one account management platform that stores all the data for not only their medical collections, but also their financial services or maybe their banking customers, for example. So everything on that system would be in scope because there is no segmentation. But thinking about all the different processes that are involved with where the data is stored, processed, or transmitted. Also, those would be two examples of non-IT service providers, which we've been focusing quite a bit on, but even IT service providers, thinking about how application is development or maybe hosting services are performed, scoping the environment to, and a lot of times this helps our clients because if there can be network segmentation performed on just those portions of their hosting environment that deal with EPHI, then making it so that you're really narrowing in on scope so their entire environment is not in scope. So doing that with network segmentation, meaning this packet of data cannot reach this other area. So really thinking about how that that can be reduced. Reducing your scope will reduce the overall amount of work that you have to do in your assessment. The other important thing I want you to remember about this too is that when you get to the point where you're receiving your validated assessment report, your certification, hopefully your certification report from HITRUST directly, that definition of scope, the systems that are in scope, will be in the very beginning sections of that report. So the reader of that report will know exactly what is scoped within the report that they're reading. So it's made very clear to the reader. So again, this may be your entire organization, your entire network. It may be a segmentation of your network based on how you have that from a technology standpoint. So let's go ahead. Okay, so again, this is really a lot of what I said previously, defining the system boundaries within scope. Again, if you have an unsegmented or flat network, everything will be in scope. So, using firewalls and routing technology and making sure that the packet of data cannot pass through the segment would really reduce your scoped environment. So you can go to the next. So I want to show you, this is an example of a network diagram. This should look very common to you if you've never seen this and you need to develop one of these. This is a great example to follow. Basically just showing all the systems within your environment. Now in this example, I just wanted to kind of give you a demonstration of, let's say for example, the data center up in the top left is your scoped environment, and the public outreach, the counseling, the HR down there in the bottom right is not. Something you don't want those systems to be in scope. So you would have to ensure that you had a proper segmentation in place so that those systems are unreachable. And so that's one of the ways that you can define scope with your environment. And the reason why I really am spending so much time on talking about scoping is because it could be the difference between, a 300 requirement statement assessment and an 800 question assessment. So by reducing it and, really applying it to those segments of your network that are the most affected can really reduce your amount of effort in the data that you're trying to protect. So obviously, if for some reason the public outreach section of the network needed to access EPHI to perform their business, when you have no choice. You have no choice but to include that entire environment in your scoped environment. So we can move on to the next. All right, so let's assume that you understand which business units, which geographical locations, and which systems are in scope. So once you really define that, you know which servers, which firewalls, which routers, which all of those equipment that's in scope. So now I want you to think about the system risk factors. that are going to come into play that help you also build the assessment. So remembering there's up to 320 possible requirement statements if you're doing a security-only validated assessment, which is the most common, or up to 845 for what's considered the comprehensive review within the CSF. And so these risk factors that I'm going to talk to you about right now, these organizational risk factors, will determine how many of those requirement statements will apply to you. Now, keep in mind the assessment domains remain the same, so there's still 19 assessment domains regardless of how many records you're maintaining. But how the CSF works is it's scalable. It's scalable according to these risk factors. So, and it makes perfect sense that they're doing it this way, because there's a direct correlation between the number of records you're storing and the amount of risk that you have. I should say storing, processing, or transmitting. Because there is the risk factor that I want to talk to you about is the cost of a data breach. So the cost of a data breach right now for health care information, according to a 2016 study conducted by the Ponemon Institute, is around $402 per record. So any other piece of data, whether it be financial services or something that's a little bit less regulated, is right around the $200 to $250 per record. But because of the amount of regulation surrounding healthcare information, because of all the state laws that require notification, for example, the cost of a data breach is significantly higher. I believe it's the highest when it comes to actual healthcare data. So this particular study, if you want to go and look for it yourself, it's the Ponemon Institute and Symantec, sponsored by IBM, and it can be found, and they do that every year. They evaluate the rise and fall of the cost per data breach, and there's really no fall. It's continuing to increase as far as the dollar amount per record. So this makes sense that the CSF, the Common Security Framework here that we're talking about, is scalable, because a company maintaining let me see here, a company maintaining something like less than 10 million records does not have the same amount of risk as a company maintaining between 10 and 60 million records, or over 60 million. So that's the threshold right now for level 1, 2, and 3, is if you're maintaining records less than 10 million records, that's considered level 1 within the CSF. Maintaining between 10 and 60 million is level 2, and over 60 million is level 3. So if you think about, like I said, going back to the cost of a data breach, really being scalable with the number of requirement statements that will apply to you as an organization based on that total risk calculation that really boils down to how many records are you storing, processing, or transmitting because of the cost of a data breach and that financial cost associated with that. Not only the financial cost, but the cost to the consumer of, potentially ID theft and et cetera. So that's the core of what makes this a risk management framework, is that it's scalable. And in some cases, it doesn't necessarily matter. It doesn't matter as much depending on how many employees you have, for example. What really matters is how much data do you have. So I wanted to give you an example of, pretty much a minor, a fairly basic assessment, I should say that, with less than 10 million records, all other quantities won, is about 131 requirement statements. So that's pretty much the smallest assessment that you can go through. But if you have between 10 and 60 million records within that you're storing, you can double that number. The number of requirement statements goes up to 235. So I wanted to give you kind of an idea of how these particular risk factors really will change the size and the scope of your assessment. So if you contacted Kirkpatrick Price tomorrow and said, I really need to have a HITRUST validated assessment performed, could you be our assessment firm? One of the first things that we're going to say, of course, is yes, and then we're going to ask you, how many records do you have? How many records do you have? And say, for example, you're not sure how many records you have in total, which is pretty common, that people don't know exactly how many records they have. So that's why when you'll see under there, that second bullet point is record count annual, and there's an A next to it. So that's an alternative. So if you don't know how many records you have in total, we're going to ask you how many records do you have, do you store, process, or transmit annually? Because that number will help us determine, they're correlated. So that number can replace the other as a risk factor and give us the same calculation as far as exactly how many requirement statements will apply to you. So let's see what else I wanted to say about that. The other things that I want you to consider, and this is not an all-encompassing list. So one of the first things I said, the thing that will most impact the size and scope of your assessment is that number of records, but there's also many others, like geographic factors, being state or multi-state, meaning is the data stored in one state or does it cross state boundaries? Is it in multiple states? Is the system or are the in-scope systems accessible from the internet? So basically, is the data, is the EPHI accessible somehow from the internet? Now, these all increase the number of, if you answer yes to that, for example, it does increase the number of requirement statements that will apply in your assessment. Another example is the system accessible by a third party? Does the system transmit or receive data with a third party? And is it accessible via mobile devices or from a public location? And another great example is how many system users are there. So a lot of these indicate, levels 1 through 3 based on what the control is. And I think it's on the next slide that I'm going to kind of give you an example because I kind of dug into this a little bit already. But in this slide, it tells you, actually, can we back up just one? Okay, there we go. So in this one, it really gives you more detail. Like I mentioned, the primary factor is how many records are you storing in total or annually. But beyond that, these factors that are listed here are all taken into consideration when the assessment is being built. So if you already have experience working with the MyCSF tool, maybe doing a self-assessment, these would look very familiar to you because you have to answer these risk-based questions before you can actually build the assessment. The same thing would happen if you contracted with us to go through a gap analysis or a guided self-assessment. We would work with you and determine the answers to all these questions, and then the assessment itself would be built. So these are all risk factors that you need to know before you start navigating the CSF document. So if you're going to do kind of the self-assessment or the gap analysis on your own, you would download the CSF document from the HITRUST Alliance website. You would start to review it yourself. You would see very clearly which of the controls listed in the documentation is required for certification. And then your next thing would be, how do I navigate the levels? How do I know if level 1, 2, or 3 applies to me? Because the levels are on the control level. You're not considered level 1, for example, across the board because you have less than 10 million records in your database. That's a misconception that I want to clarify right now, because how you navigate the levels is at a control basis. So if you answered that you had, for example, you may have less than 10 million records in your database, but let's say, for example, the number of system users is level 2, which is between 500 and 5,500, you would have to make sure that you complied with level 1 and you also complied with level 2. And I kind of want to give you an example of what that looked like, a real-world example. So let's say, for example, you are a level 2 for system users, and here's one of the controls that would be affected. So level 1 requires, unsuccessful logon attempts limited to 6. So it limits your unsuccessful logon attempts to 6. Because of the system users being greater than 500, now you're up to level 2, which means you have to comply with all of level 1 requirements, and you also have to make sure that level 2 requirement statements are met. So it shortens that 6 down to 3, and it also requires, for example, that a message to the system console if a maximum number of logon attempts is reached. So what it does is it layers the requirements. So because you have reached a risk factor that is greater than level 1, it applies to those controls that are affected. So in this particular example, it applies to those controls that have to do with how many system users you have. So it's not a one-size-fits-all, meaning level 1, 2, or 3 across the board. It really varies based on what the intent of the control is and what your environment is as far as those numbers. So I wanted to give you that kind of example to show you how these risk factors are used in determining the overall size of the assessment. So we can go on to the next slide. So we've talked about organizational, system, and now I want to talk about the regulatory risk factors. So the regulatory risk factors, you're also going to have to know when you begin any assessment, because if PCI compliance is required for you, for example, or if you're required to meet FSMA compliance, these all increase the size of your assessment. So there is requirement statements that are added to your assessment based on these regulatory requirements. So if FTC red flags rule compliance, applies to you, and a great example is the state of Massachusetts Data Protection Act, which really applies to anyone who is maintaining access to data of Massachusetts residents. The same thing for Nevada. So the state of Nevada, for example, and the state of Massachusetts all are obviously protecting. They take data protection to a higher level than just breach notification. So there are requirements for the business when you're doing business and you have data that pertains to Massachusetts or Nevada. So if these are applicable to you and you must comply with them, then it's really incorporated into the HITRUST assessment. And we can go on to the next slide. I wanted to give you an example. Some of these that are here as options may not apply to you. They may only apply to a covered entity, for example, but they're in the process. So there's documentation that will help you determine if these are applicable to you that you can reach out and you can determine from HITRUST. It's built right into the MyCSF tool. But if you're not sure about this, it's definitely something that, we can help you navigate. Or, for example, it's something that, from a legal standpoint, you may want to get the input from your attorney or your counsel to make sure that you are, adequately selecting these. So, for example, if you are subject to the Texas Medical Records Privacy Act, I wanted to give you kind of the definition behind this one because it'll give a good example of how you can apply the same type of logic to the remainder of the regulatory factors. So the Texas Medical Records Privacy Act applies to all quote-unquote covered entities as defined by the law. Includes business associates, healthcare payer, government units, information or computer management entities, schools, health researchers, healthcare facilities. The key word there is that it applies to business associates. So it applies to business associates that possess or are required to protect health information of a Texas resident. So again, this applies if you are maintaining data of a Texas resident, very similar to Nevada and Massachusetts that we talked about in the previous slide. These are all, this is a continuing, this slide here is obviously continuing from the slide previous, just describing, all of the possible regulatory risk factors that can come into play. I want to give you an example. Some of these pretty significantly increase the size of your assessment. So particularly FSMA and PCI compliance really affect the size, the number of requirement statements in your assessment. So really think about that. If FSMA is applicable to you, if you're doing direct work for the federal government, and this again comes into scoping. If the scoped environment where you're performing any work that maybe have to be FSMA compliant is separated from your healthcare environment, then maybe FSMA doesn't apply to that scoped environment. Same thing with PCI. If your cardholder environment is, maintains proper segmentation from your environment that is storing, processing, or transmitting electronic health information, then you may be able to separate those out in scope and say, during the scope of your HITRUST assessment, maybe PCI is not applicable. I don't know how realistic that is because I see a lot of overlap there, but that's an example of how you can use scoping your environment and really determine which set of requirements are applicable, to each. I forgot to mention earlier, and I feel terrible that we're now almost 40 minutes into this, but I really wanted to get some questions. If anybody has any questions, we want to use the Q&A feature, and I do see that we have a question in there. Let's see. if records are not stored, are the number of records a determined level on an annual basis? Absolutely, that's a great question. Then yes, if you're not storing those records, if you're using them in some sort of a temporary situation, then you would want to go based on, well, actually, you'd want to go on the number that were stored, because the stored amount, HITRUST assessment is a point-in-time assessment. So your scoped environment will be the number of records that you're storing at the time of the assessment. So you really want to think about that and treat that very carefully, because the primary risk factor in that case is the total number of records stored. And if you think about that from a realistic standpoint, how many records are stored at any given point in time. You know, if you're effectively disposing of those records, then your risk is lower. If you're not retaining them, or you're not retaining them. That's a really good question. So I hope that we have other questions that come in. I failed to mention that earlier. All right, so I think that pretty much concludes what I really wanted to talk about today. I wanted to, of course, mention to you how Kirkpatrick Price can assist you with your overall HITRUST CSF compliance. We are a CPA firm, so we do perform the SOC 2 engagements. A lot of companies are incorporating the HITRUST framework into their SOC 2, which is considered the SOC 2 Plus option. One of the ways that you can start right away, if you're already receiving a SOC 2 and you want to incorporate HITRUST into that process, you can have the HITRUST mapping to the trust services principles inserted into Section 5 of that report, which is actually an untested section, but what it does is it shows the reader of that report that you are working towards HITRUST compliance, and there's a direct correlation between the trust services principles of SOC 2 as well as the HITRUST Common Security Framework. There's a mapping that's been done by HITRUST in cooperation with the AICPA that does show how the crossover of controls exists between SOC 2 and the HITRUST CSF. So many of our clients that are receiving SOC 2 today that want to start working towards HITRUST and they want to demonstrate that they are working towards HITRUST compliance to their clients want us to simply insert that mapping into their SOC 2, kind of showing a level of due diligence, not as great as having a validated assessment, obviously, but it's step one that you can do fairly quickly and fairly easily. A SOC 2 Plus, that is where the HITRUST CSF, the requirement statements that would be applicable to you are simply replacing the trust services principles that they're mapped to within the SOC 2. So that's considered a SOC 2 Plus, and in that case, we as a CPA firm are attesting to your HITRUST compliance. So we're basically making a statement that you are either compliant or not compliant with the HITRUST CSF. And then, of course, we move down into the next level, which would be the SOC 2 plus HITRUST CSF certification. This would be where you receive a SOC 2 and you also have an appended HITRUST certification that, again, is only provided by HITRUST. In that case, you must conduct the SOC 2 and you must also conduct a validated assessment, but the two reports can be put together so that when you're giving your SOC 2 to those clients that are asking for it, they're also receiving your HITRUST certification. And of course, the fourth bullet point is HITRUST certification. That's really what we've been focusing these webinar series on, as far as that would be actually going through and performing a validated assessment, submitting all of that validated information to HITRUST, and then HITRUST either awarding certification or producing a validated assessment report. Other ways that we can help you is starting out with the assisted HITRUST CSF self-assessment. In that case, what we would do is you would sign up for the HITRUST portal. We would basically act as a guide and take you through all of the controls that would be needed for you to perform the assessment. And then, of course, the validated assessment would be the step beyond that. We also do a lot of policy and procedure drafting. So if you come out of either a self-assessment or a guided self-assessment, or you just say, I believe that we're compliant with most of the technical nature of HITRUST, however, we are just missing a lot of policies and procedures, then that's something we can definitely help you with. And, of course, a guided risk analysis and general guidance and consulting. And then on the next slide is kind of it's a little bit of a logical flow chart to kind of say, you know, what do you need? How do you know exactly what you need? And this is something that we commonly get asked. You know, someone calls and says that they are interested in HITRUST compliance, or just not knowing where to start. The very first question we're going to ask you is your client asking for certification? Because they, you know, they will be very clear on asking for certification if that's what they require. So if certification is not required, then they may be asking for the HITRUST CSF to be incorporated in a SOC 2. So step one is really knowing exactly what your client is asking for, and then we can help you navigate to the right solution based on that. So if it is required, we'll also ask you, for example, is a SOC 2 required? Because there's going to be a lot of efficiency gains. For example, if you have to do certification for a group of clients, but you also need a SOC 2 for other clients, as both an assessment firm and a CPA firm, we can combine some of that effort so that the process is a lot more efficient and from a cost standpoint, a lot more beneficial to you. So we're going to ask you those questions and kind of navigate to what is the best option for you. I have another question here that I wanted to address really quickly before we get to any other questions. So if we have other certifications such as ISO 27001, ACA, PPMS, does that satisfy most of HITRUST? Is that part of the scope determination question? Actually, it's not part of the scope determination question. That's a really good question. But since the HITRUST CSF was built on the ISO framework, it was built on ISO and has since pulled in and adopted many other known frameworks that have been proven to be effective. So, but ISO is at the core of it. So if you already have certifications such as the ISO certification, then you're going to be able to draw a lot from that experience of going through the ISO process. You're going to have a significant number of policies and procedures. You're going to have a scoped environment. So I would say that it's going to help you tremendously, but it is not a question that they ask you in the scoping, because you still have the same amount of risk present as anyone else that hasn't gone through ISO. So again, it's going to really boil down to the number of records that you are maintaining, processing, and storing. But I think, quite frankly, to answer your question, it's not going to affect the number of requirement statements that are in your overall assessment, but it is definitely going to give you a big step forward as far as being prepared for the audit itself. So I hope that helps. All right.
I'm not seeing any other questions. So just as a reminder, you will receive this presentation and a copy of the slides in your email. And that email will also include the links that Jesse mentioned before, some other HITRUST resources. And our next webinar will be called the HITRUST CSF Assessment Process and Beyond in about a month on August 24th. And I'm not seeing any other questions, but if you do have them, please email Jessie and she'll be happy to answer them.
Yeah, I wanted to just comment, Jenna, that the next session we're going to be talking about the CSF assessment process and beyond. It gets into how controls are scored. So the other unique thing about the HITRUST CSF framework is that it uses the 5 levels of maturity model scoring. So it's really good to understand, and those 5 levels are policy, procedure, implementation, and then measured and managed. So we're going to talk through what does it mean to have policy, what does it mean to have procedure. Obviously, implementation is the controls actually functioning, but then when we get into measured and managed being the kind of next level in compliance, the HITRUST framework is a little bit unique in that it does use that. Those that are familiar with ISO will know that. But the next session is really going to get into how are they scored, because when you're going through a validated assessment, each of the 19 assessment domains must reach a 3+ or a 3+ a corrective action plan to actually achieve certification. So the scoring mechanism is a critical part of achieving certification. So that's really what we're going to get into in the next session. So kind of wanted to give people a little bit of a preview of what we're going to talk about.
Awesome. Thank you so much, Jessie. That was such good information. If you have any other questions, please email Jessie. Her email is on the screen. and everyone have a great day.